Well, thank you, Tina, and thank you for having me here today to really talk about something that's important in my life. I know many others too, within BC and even across Canada too. But first, I'd like to begin by acknowledging that the land on which I am on, and that I'm privileged to call home for the last 2 years, is the unceded Salo territory, known to settlers as the Fraser Valley and Lower Fraser Canyon of British Columbia, and I'm specifically in the town colonially known as Abbotsford. So there's a couple of learning objectives. Even though this is going to be a 15-minute presentation, we're still going to learn some things, which is always nice when it comes to these echoes. And so we're going to identify, hopefully you can identify at the end of this, how people in BC have experienced bereavement during the pandemic, where they were able to access support, and also how support has changed through the pandemic. And some of the, I understand some people who are here have had experienced some loss during the pandemic, and this may, sit with you. This may seem that other things is more true to you, and that's all okay because our grief journeys are completely different. But yet there are some similarities that we can sort of talk about, and that's what today's about. Is really talking about some of the general findings that we have had. So just looking at the COVID-19 pandemic, it impacted everything, every aspect of life, and that is including how people have died and also how we're able to grieve after their death. And the BC Centre for Palliative Care really noticed that many of the restrictions and changes during the pandemic were were impacting and would be significantly impacting the bereaved and how they're able to cope following the death of someone significant to them. And so that's when the center really began to research this and really try to understand the impact this is having on the bereaved. And at that time, there wasn't really anything out there, very limited information. And so in May 2021, the center really initiated this grief and bereavement project with 6 key members on our steering committee. And you can see them there. And I gotta say, these individuals were so helpful in really guiding the trajectory of these projects, and it's so important to have people on there that know the field really well, but also public partners, so people actually can really speak to the grief as we sort of move forward. And we had a wonderful team, project team. There's a couple on here. There's even more that are not mentioned. And the goal of the project really was to conduct research to understand the current state of bereavement in BC and to use this research to guide the province-wide roundtable discussion with experts and leaders in bereavement services that really aim to identify priority actions to address the needs of bereaved people and recommend strategies to improve bereavement support services. And so we set really to understand at the end of this all how people in BC experience bereavement beginning in March 2020, how and where British Columbians access their support, how bereavement support has changed through the pandemic, and also what was effective for the support and what could be done better. And so we have completed 10 different research projects to date on this subject. We're only going to be really focusing on 4 of them, which really included bereavement support service providers and individuals with bereavement experience during the pandemic. But one of the main goals was to do the provincial-wide roundtable, which is done, which is really exciting. But we're not going to talk about that in this one. It's going to be on our next ECHO session. And so when we look at the bereavement service providers, there are 43 different organizations that took part in a survey, and also 16 of those were then interviewed. And then when it comes to bereaved individuals, 182 took part in a survey and 20 took part in an interview. And so what were the findings in general? There's a lot of findings, so we really minimize it to sort of answer some of these questions for you. So how people in BC have experienced bereavement during the pandemic is one of the first questions. So using both the bereavement service providers and the bereaved individuals data, there are 4 main themes that were identified on how people in BC have experienced bereavement during the pandemic. So the first is there was a change in the ability to really be with the dying. And so there was this, it was limited, or some people had no contact at all. And you read some of these quotes and they're very heartbreaking. So here's one: I was unable to be with and say goodbye to my loved ones because of COVID, which made my grief worse for me. Another change was a change in the ability for death rituals, like a funeral. Some had limited attendance, others moved to online, whereas others really just postponed it for a long period of time. And people really found that if they did or had to use Zoom to do a funeral ritual, that it was could have been challenging, especially with audio and visual issues that they experienced. And here's a bereaved individual saying, "We haven't been able to organize a memorial. It was and still is a nightmare with no real sense of closure." Next, there's a change in the ability of the bereaved to cope was really impacted their ability to really process their grief. And you don't know what you need until it's gone. And that's one of those things here, how much we sort of needed the freedom and the restrictions really reduce our ability to use some of our past coping mechanisms. And so here's some of the reasons that they give was social support, which is a really big one. So family, friends, also different clubs that were able to go. They're just more limited. And a lot of times if they were able to, it was through physical distancing. And we had, if you remember, we had to select those social bubbles. And, that was hard. It was really hard to do that. There was also this increased more loneliness for a lot of people, and people had this fear of COVID also at the same time. And a lot of people spoke about this lack of like having touch or feeling the hug of someone when they were grieving. Also, there's limited forms of previous self-care, so like being able to go to the gym or going to restaurants. There's less opportunities for distraction. Also, greater secondary losses people experience. This could be a job loss or just loss of work family. Some of us still have that, where it's like you're working from home and you don't get sort of get that sense of the work family. And parents had also more challenges, so really less support for them, being able to support their children in other aspects of their life, but also the homeschooling that they had also take on. And lastly, it was just limited access to desired support before and after. And so you see this quote here from the bereaved, "The inability to gather with others for just simple social connection made my grief experience much worse." And the change in the complexity of the grief really leads, you could sort of say, from the inability of the last three. So the change in the ability to be with the dying, the change in death rituals, and also the change in the ability to cope. Additionally, some other reasons were actually spoken of too, and that there was an increase in drug toxicity deaths in people's lives and also suicide. Also, multiple losses were commonly discussed, and there was an increase in coping by the use of avoidant or extremist means. So this would be like drugs or alcohol use. And just here are some quotes. So from one from the bereaved, multiple losses, the whole family community are dealing with stacked grief. We barely have a chance to process one loss when there's news of another. And this is accelerating. And for a service provider, we're all getting more complicated grief because we're layering a loss of a family member with other losses in our lives, whether it's loss of old normal or loss of jobs or loss of companionship or loss of friends. So where did British Columbians really access some of this support? And just go quickly over some of this chart. So this is from the bereavement survey, and this is specifically looking at different social circle supports. And most people really indicated that they really relied on friends and family after a death. Also, which hopefully not surprising to many, pets were also a big significant support in people's lives, as well as work colleagues and neighbors and other members of the social circle. When looking at informational support, you sort of see people did use information from books, the internet, even podcasts, a lot of grief podcasts out there, and also social media is another way people were accessing support. And looking at service providers, so for here, the individual spoke about really utilizing individual therapy. It was most used. Next was group support from an organization. And then you have physician visits, religious spiritual leaders, and memorial events were also used. And then also peer support. And then additionally, there was grief talks and seminars and conferences that people went to, also grief helpline, and also the grief retreat camp, or also grief intervention. So how bereavement support has changed through the pandemic? Well, first we asked, was that a thing? Like, did it actually change? And 87% stated that support was affected, with 11% saying no. And so basically, how was their desired support changed? And so you look at the first social circle support, Now, what changed really was a lot of it became virtual. It was most commonly used, so there was just limited in person, except for those people in your bubbles, but also your pets. Many people stayed away and would call or Zoom, and a lot of people found this support insufficient. They really desired that in person, that kind of the company. And then when looking at the service providers support, they really switched to providing support online. So either one-on-one group, or even remembrance ceremonies, education or training. So if they didn't switch, they were canceled. And so there's just very limited in-person support uh, at that time. But there were benefits with this newer supports that were being spoke of. So the bereaved were able to access support beyond their traditional territories, which was a newer thing that was coming, which was really helpful. But there's issues with that too. So some bereaved struggled with the virtual supports; they didn't like it. Many spoke of really just wanting or waiting for in-person supports, and some people didn't have the cell phone service or access to computers. So demand, when it comes to the service providers, they really spoke about demand increased for most organizations, some decreased. But they also spoke that there was this waiting list prior to the pandemic, and it's just really increased. And different additional challenges that were mentioned was a lack of grief and bereavement literacy. And so this was the bereaved themselves didn't fully understand, grief and bereavement, the friends and others around them, family, even healthcare workers, counselors, and people in the workplace. So people talked about how they and others really just don't understand and have the knowledge to understand grief and bereavement. And many spoke about how people really minimize their loss and really said unhelpful things like, you need to get over it. And these things aren't helpful. They actually can, hinder people's ability to cope and to reach out for support because it takes vulnerability to reach out. And when we do it and we get these negative interactions, we tend not to do it again. So it's just really important to know that. And then also their friends and family, really, some of them avoided the topic and sometimes pretended that nothing happened. And so the bereaved also talked about more issues when it comes to professionals. So some physicians and counselors, they didn't really have the grief training to be able to talk to them. And they felt that it caused more harm than good for them. And also in the workplace, the bereaved wanted really greater support, more compassion with the transition to work. And here's some quotes, both from the bereaved. One said, the physician visit was unhelpful. Both times she was telling me I am depressed and I need antidepressants, uneducated in grief. Another bereaved individual spoke, my work overall was very unhelpful in the sense that I felt there was this expectation for me to get back in the swing of things, too much stress. Other challenges that were mentioned was this lack of awareness of basically where to find support. Like, where are the service providers to provide support? And so people just didn't know where to look. And if they would ask someone, they didn't know where to look either. There's also a lack of access to desired services. So some people found that the services were just difficult to physically access. Some had limited suitable programs for what kind of needs they had. That could have been the type of loss that they experienced or even the type of death. And some even lacked the cultural or language specific services that they required. Wait lists, and which we talked about a little bit, and timing of care. It was an issue. One person spoke, I remember, that they were on a wait list for 18 months when they were filling out the survey, and they still weren't being supported. That's a long time to wait, and the emotions that one would get waiting that long for support would just, hinder them as they were processing their grief. Then lastly, these financial barriers. So as we sort of looked at, remember the most common service provider support that people utilized was therapy, but therapy costs a lot of money. And so there are just really, people spoke about unable to access those services because of the lack of finances and ability to go. Counseling, as I sort of said, is expensive, and some health plans really limit the amount of sessions you can attend, and some don't cover it at all. And for service providers, they spoke that they would offer more programs, so they would increase access and reduce wait lists, but they need government funding to really fund those programs to really provide the better support. A lot of it comes through donations, which is why it's important to donate to those bereavement support organizations. to really help them out. And looking at what support helped. So first, looking at social circles, talking and feeling heard. So pre and post death are just so important. It really helped with them processing emotions, allow them to cry and also be angry. It really normalized those feelings when it comes to grief. It allowed them to tell their story and how important that is. To talk about their memories, even hear coping ideas, and to just not feel so alone. And they really spoke about consistent support is the best support. So they enjoyed people reaching out, but it's those people who are consistent in their support that they really enjoyed. Other people spoke about other tasks, which would be helping out with tasks around the house or receiving gifts and cards, even financial support um, occurred. Looking at service provider supports. So once again, talking, feeling heard, the same thing with friends and family or other social circle supports, just important. But they also additionally like that they were trained in helping others work through emotions and really providing guidance when needed. And they really are talking about too about the importance of having people with lived experience. So this would be in group or one-on-one supports and hearing their stories and not feeling so alone. And processing emotions when it comes to these external supports, processing emotions away from family or friends were seen to be beneficial. Some people found that it was easier for them to share this way. And they really spoke about sometimes not wanting to add anything extra to their friends and families. And some of us may understand that and can relate to that. So to not feel like a burden on others and really mentioned that, some people even mentioned that they were hiding how they were truly doing to their family and friends, but then they would share the truth to people on the outside. And so when you look at for desired services, what kind of greater access would they have wanted to have? And so they wish for greater access to family and friends and just others around them. And not so much pets, as you can imagine, they probably had their pets and spent a lot of time with them during the pandemic, but friends and family. So that could be because of the restrictions, it could also because that the lack of grief literacy, people sort of stayed away. Then when you're looking at the service provider support, they wanted more support from trained staff and healthcare providers. So specifically, they wanted more individual therapy, also group supports were most desired. But also, when you look at the other ones, also wanting individual peer support and more memorial events and physician visits and religious and spiritual leaders. And a lot of that said like really because of the pandemic took a toll, but also the wait list, right, when we talked about. And then additionally, people wanted more grief retreats and camps to be able to go to and connect with others and learn, and also grief talks and workshops to be able to attend to. So then what can be done better? So we sort of see a lot of challenges and gaps within services already and a lot of the frustrations that people have went through. But what can we do better? Because I think that's the beauty of research when it's done. The research I love is when it's done to help the community in one way improve. And so this is what our next task is going to be, is to really to talk about this in our groups. Because I know like the research says one thing, but you have your own insights into maybe what can be done better. So the question for our group today, so we're going to have about 15 minutes to discuss it within a group, and then we're going to come back to the larger group, and I'm not going to force you to share, but if there's something that came up that you want to share to the group so everyone would be able to listen to, we'll be definitely appreciated to hear that. So the question is, from your perspective, how can your community and workplace better support bereaved people who are grieving?
Okay, they should start dribbling back in a sec.
So Tina, is everyone back from the
I believe
groups?
so. We should be good.
Okay, excellent. So thank you everyone for participating in the breakout room, whether it be listening or sharing some ideas. I know 15 minutes isn't a lot of time to share all your good ideas, and there's a lot of things that we can improve on when it comes to um, support for those who are grieving within our community and workplace. But I'm really curious from a personal standpoint, really, what was shared, and if anyone wants to share some of the insights, either yours or that you've had from listening to people share about the improvements that could be made and how we can do that. So I'll bring it to the floor. Does everyone want to share any ideas that they have? I guess you can either raise your hand or raise the animated hand. There are two options.
I see Katie O'Brien's got her hand up.
Thank you. Hi, I'm Katie, and I'm with Revelstoke Hospice. In our breakout room, we kind of spoke of a bit of a spectrum along the way of community conversations, all the way through to grief and bereavement groups that are put into place. The importance of having just open conversations, perhaps around something like a death cafe, to just engage individuals in the ability to talk about death and grief and everything that's associated, to more structured styles of conversations, such as having a group that has a facilitator for upwards of 6 to 8 weeks. But we also spoke of how a lot of those more structured groups are really overwhelmed, and how since the pandemic, we've seen a lot more individuals from many different areas, many groups that are have associations with death and loss, such as overdoses, substance abuse, and a lot of those referrals are being channeled through to hospice care and to a lot of offerings that are just trying to keep up. So we kind of spoke of that difficulty, and where is the boundary of who can we help, and should everybody be referred to it's traditionally hospice that offers these groups. Is there maybe somewhere else we can spread out the options and opportunity for conversations? But I think touching on that idea of it's a spectrum of conversations, from something as easy and laid back as a death cafe to something that's a bit more facilitated. That's kind of something that we came up with, but it may be easier to have that wide breadth of offerings to eliminate a bit more of that overwhelm that a lot of organizations see.
Wow, those are a lot of great insights that you and your group sort of spoke about. Could you just speak about like the Death Cafe? Some people may not understand what exactly that is.
Death Cafe is a kind of a global movement. It was started with an individual based in England, and who he has since passed, so a little homage to him. It is a space where there's 3 rules. You drink tea, you eat cake, and you talk about death. And it's about 2 hours of individuals' time. Normally, in a larger city, it's strangers congregating at a coffee shop after hours, just to have open, there's no agenda, like unregulated, conversations around death. And so to allow that just easily flow, some individuals bring forward their own experiences with grief. Some bring forward they recognize the inability to have conversations around death. And so it's just a space that's just open to speak about anything around death and loss. So it's very, laissez-faire.
That's good. It almost invites you in to be able to explore it with people who want to explore it too. I think that's one of the keys is finding those people who want to talk about this subject, right? And that's sort of a space to do it. That's great. So thank you so much for sharing. Is there anyone else that wants to share? I see Marnie has put in the chat that the Canadian Grief Alliance could be a way to connect with others in grief organizations and services. I see Aman has his hand up.
Hello, everyone. Yeah, just wanted to quickly touch on something I touched on in our groups as well, is the implementation of cultural perspectives. You know, oftentimes, you know, we'll in our line of work, depending on what line of work we're in, we'll encounter clients who have that sort of language barrier. You know, particularly in my culture, there are many elders or certain individuals who cannot speak English or who have limited English speaking skills. So if there were more cultural supports that are specifically targeting those people and helping them realize that what they're going through is, you know, it's a delicate situation, it's a tough situation, it's emotionally difficult, it's mentally draining, and that there are resources that we can redirect you to or recommend. This is just coming from like a social work perspective, because usually in times like these, in times of grief or bereavement or things of that nature, I think some of the most important things you can do is surround yourself with positive-minded people that are there for you and that are, you know, a support system for you. And if they also identify with their culture, your cultural values, ideals, belief systems, then perhaps that's even better, because there's a certain layer of rapport that's already established just based off of that. I also just touched on the fact that, you know, this reminded me of like all these discussions and the presentation itself reminded me of the, you know, certain presentations that these politicians would come in and do for the kids in high school gymnasiums. And oftentimes the biggest issue was the fact that there's a bit of a disconnect between the officer or the politician delivering the presentation and the individuals, the students, however, that were receiving it. The only reason why is because the particular individual who's doing the presentation, who would identify as a Caucasian, wouldn't necessarily relate to the struggles that individuals in our community and culture were facing at the time. And so even though their intentions were good and noble and right, they weren't getting across to certain members of our culture. And as a result, you know, a lot of my colleagues, my friends dabbled in that type of lifestyle that wasn't necessarily the right one, and some of them lost their lives. So that's why I think that, like, if there's like cultural supports that are coming from an individual who belongs to the type of culture that the person also identifies with, then it makes that process easier. And yeah, that's all I had to say.
Those are some really great insights. Thank you so much for sharing. You're right. The culture aspect is really huge, and also the language. A lot of it's in English. The material's in English, and it's not just about translating it to a different language. You have to understand the culture in which you're translating it too, because they're going to have different ways of saying and speaking about grief and bereavement and what works and what helps for them. I think that's an important part of really increasing the knowledge that we all have in how different cultures do. Find support for grief and bereavement. So that's a great point.
Mhm.
And we have Joan, their hand up.
Hi, everyone. I just wanted to definitely appreciate Aman for your points, because it reminds me that we've seen across North America that this pandemic disproportionately impacted people from marginalized communities, right? And continues to. We are living 3 years into a climate with climate change, inflation, we're burnt out, all of this. So we're going to have to continue to do and meet the needs of, you know, grief support. And I think what I'm hearing a lot of too in our conversation is education across the larger culture, across our mini cultures about the very real physiological impacts of ongoing grief, maybe not even, some of it is personally related to deaths we've experienced, but then, you know, there's also a lot of grief related to the situations that we're living through, and needing to not only keep an eye on our micro level programming, but I think it's really important at like a macro level to keep this lens in mind and to advocate that this is public health issue. It's not just, you know, individual services, and we all do need funding, but we also need the value on like a public health, mental health level, to re-examine how our communities are built, how our lifestyles are impacted, especially as we see, you know, we're in a different phase of the pandemic where COVID is now endemic, but still, you know, my worry is that we will bounce back into this more productive, work through, feeling sick kind of culture, rather than what we've needed to do, which is slow down and be really tender and, you know, care for ourselves and for each other in a much more attentive way. So I just want to put a plug in to think about the macro level of advocacy and the different communities that are disproportionately impacted by living in this climate.
Appreciate that's a great comment. I worry about that too, and especially like people tend to revert back to the way things used to be, and it was broken, you know, like, and that's the whole point of why it was what the pandemic really, I think, brought out, especially with grief and bereavement. The systems were broken to begin with, and there's gaps and challenges that, you know, the pandemic really showcased, and we got to sort of see some of that. And so, but I'm also very hopeful because of the work that the center is doing and the stakeholders. When we'll talk about sort of the next talk about the direction that we're going to be moving with the action plan on implementation of what we've seen, so we can minimize this if it happens again, or just in the future, to really provide people that support that they need, and the education that the public needs. Because you're right, it is a general health concern. Like, people are not being taught in schools or in the workplace on what's normal when it comes to grief and bereavement. So yeah, great insight. I love that. And we have time for one more comment. And so,
Got a hand up from Gabriel.
Well, hi there. I just wanted to add our group looked at sort of two topics. One actually just very practical, had to do with money, of grief support and bereavement support. 3 days to grieve, as supported, and it seems insufficient. To be in a state of crisis, and that's all that you have, right? Unless you have the luxury of having additional supports to be able to take more time off, to not worry about that financial stress, because there's stress from every other factor of your life. As well as the other thing we talked about was just awareness of what the resources and supports are. Can be a huge barrier, right? Like in the town I'm in Vernon, there actually are a number of supports for people with grief and bereavement that don't have long wait lists, and sort of letting people know how to access that and where do you start. And when you're grieving, you're not in the best frame of mind to sort through an institutional website to figure out what's out there, right? It can be a barrier as well.
I agree. Thank you for sharing. I agree. That's just understanding what's available, and to get that knowledge ahead of time, rather than when you're trying to grieve. Just the pain of even thinking about that is just kind of overwhelming in itself. And you're right, the culture needs to shift. If prolonged grief disorder can be diagnosed after a year, but you only get paid for 3 days, like, there's a gap there of like over 300 days. Like, what are we doing, and how are we supporting and providing that support? So I want to thank everyone really for sharing and talking within your groups, and just being here today. It means a lot to me personally to sort of see that there is an interest in grief and bereavement research, and also the things we can do as we move forward within our culture and within our society. And so we have a couple last slides that I think Tina is going to speak about.
Yeah, while we're setting that up, I'll just let everyone know that Jacqueline's going to pop into the chat for you a survey link about just getting your feedback on this session. And we'll be sending out an email with that link as well. Yeah, I too want to thank everybody for coming. A nice sized group today. And I was just noticing from adult to teeny tiny little baby I see in the corner of somebody's picture there. So all ages, all represented. And I also wanted to just mention that, you know, this is the first in a long running series that Josh has been working on around bereavement and grief. And we are really opening this up in the true form of what ECHO is about, which is this all teach, all learn model that we're all here to share and learn from each other. And that we are looking at folks attending this from across sectors. So there will be, and I'm sure have been today, healthcare professionals, community-led organizations, volunteers, caregivers themselves, people that are personally bereaved. We want that wide audience to attend these sessions. So coming up, a little plug for our next in this session is on July 25th, how best to support bereaved people post-COVID. And this is from the recommendations from the stakeholders roundtables that Joshua has been hosting. This work that he's been doing couldn't have been done without our stakeholders, and we really appreciate everything that folks have been contributing throughout this process. Jacqueline is also going to post the registration link for that in the chat, and we'll include that in a follow-up email. And just to let you know, coming in August will be the start of our series on bereavement and grief literacy, and the first in that series will be around toxic drug poisoning. And our aim is to have a session every month in that series from now until Joshua runs out of ideas, and I think that might be never. So hope to see you all there in the future at more of these sessions. Please spread the word and share with your own networks, and let folks know that this is a series that is open to all. And with that, again, thank you everyone for attending today. We'll make sure that there is the package sent out for you with the recording, summary notes of today. We'll also take from the chat anything that was posted in terms of resources and links, and we'll package that all up and send that out to folks that attended and those that registered but were not able to attend today. So thank you and have a lovely afternoon.